Thank you, Chair Guthrie. Good morning, everyone. Our focus today is to explore solutions to improve Medicare payments to providers and ultimately help patients. Everyone has been hurt by inflation, driven by President Biden and the Democrats' record spending spree. Just last week, we got 2 more pieces of bad news on inflation. First, Medicare Part B premiums are increasing by almost 6% next year. In fact, since President Biden took over, Medicare premiums are up nearly 18%. Next, we found out that core inflation metrics show prices continuing to increase by 4% over last year. But inflation remains a huge problem. Everyone, from patients to providers, is feeling the pain of higher prices and higher interest rates. Patients have less money to spend on basic needs, food, housing, healthcare. And for providers, the cost of running an independent practice is growing as well. This committee has heard testimony that the whole healthcare system becomes more expensive when providers cannot afford to stay independent. Today's hearing will focus on how we can eliminate unnecessary red tape and, most importantly, sustain access to care and lower costs for Medicare beneficiaries, regardless of where they live. As many of my doctor colleagues have said, it is important to let doctors do what they do best, spend time seeing patients and less time filling out paperwork. The challenge before us is how to balance the need to ensure patients and Medicare are accurately paying for that care, while recognizing that paperwork, even if well-intentioned, can limit time spent on providing health care and increases cost. As we look to modernize our Medicare payment system, we must be thoughtful in striking the best and right balance. Today, we'll consider a wide range of discussion drafts and legislation that aims to support Medicare providers as they deal with rising paperwork, rising inflation, and rising labor cost. For example, a few discussion drafts address expiring payment initiatives. If Congress does not act before the end of the year, doctors in certain rural areas and laboratories will see a pay cut from Medicare starting January 1st. In the short term, Congress should act to avert these cuts, but we should consider why we're having the conversation every single year. If we need further proof that government should not intervene in the economy, look no further than the physician fee schedule. In our efforts to create a more perfect price control, Congress has increased Medicare payments to doctors seemingly every single year since 2003. I'm not saying that these aren't worthy endeavors. I believe in supporting our doctors. In 2015, this committee in Congress passed MACRA to get us out of the cycle of the annual fixes. Yet here we are, with a system that again has underperformed those who rely on the Medicare program. And still, some of my colleagues across the aisle would expand such a system to cover every patient in the country. The fact is, politicians and bureaucrats will always do a worse job than the market at determining the most efficient prices for an item or service. And Congress should spend its efforts on long-term reforms to the program we have now, so we're not back at this every 1, 2, or 3 years. It is also important that we recognize the greater context of this discussion. Parts of Medicare are on pace to be insolvent by 2031. Solutions like the bipartisan Lower Cost, More Transparency Act will save Medicare money in the long run. But our resources are finite, and we must make sure that we're examining every dollar Medicare spends and making sure that it's going to the right places before assuming additional resources are necessary. If additional resources are necessary, we should work together to find ways to save Medicare money in other areas. Again, our goal today is to strengthen the Medicare program and increase seniors' access to care by improving the way we reimburse providers. And I thank our witnesses for being here today, and I look forward to the conversation. I yield back, Mr. Chairman.
The gentlelady yields back. I now recognize the ranking member of the full committee, the gentleman